So 50 years into Medicare, we are now at 48.5 million people, of which 40 million are elders and the others are disabled. So it's gotten to be a very large percentage of our population. You can see that most of the elders are not real wealthy, so 50% have incomes below 22,000 and savings below 77,000. So obviously having Medicare is a very important part of their financial security. They cannot afford to be sick without Medicare. 40% of them have 3 or more chronic conditions, something we all have to look forward to. 27% of them report fair or poor health. 23% have cognitive impairment. That's both the elders and quite a bit of the disabled people have cognitive and mental health issues. 20% are dually eligible. In other words, they're eligible for both Medicare and Medicaid, and it's that population that's actually generally one of the most expensive. That incurs some of the highest costs. Many of these people are disabled, have mental impairment issues, have serious physical illnesses that make them poor, as well as eligible for both Medicare and Medicaid. And quite a few of them have activities of daily living limitations where people have to help them bathe, dress, walk, get their groceries and their food. 13% of them are over age 85. So I guess the good news is people are living longer, they're just living longer with more chronic conditions, which does, again, add to the cost. And only 5% are in long-term care facilities, which I think is different than what most people think. Many people think, everybody ends up in a nursing home, but they don't. And increasingly, they're not going into nursing homes. They're much more in assisted living and living in communities, but with these chronic conditions. And it does cost quite a bit of money to keep them going and happily living out their senior years. The revenue in terms of Medicare, remember we talked about the different sources. There's the general treasury, there's the beneficiary premiums, there's the payroll tax for Part A. So overall, you can see the total in 2012 is about $532 billion. 40% of that is coming out of general treasury, the general revenues. And that's important when you think about the fact that Congress is worried about the federal deficit. That 40% is contributing directly to the federal deficit. 38% is coming from the payroll tax, so that's the Part A, where people who are working are paying roughly 3% of their payroll into the the trust fund for Part A. 13% is coming from beneficiary premiums for both Part B as well as the drug benefit. And then the rest is coming from state payments for Medicaid drugs and some of the other, and some interest and taxing Social Security benefits. And you can see that the mix of financing varies by the silo. You're in Part A, Part B, and Part D. But the overall impact is that it's getting to be a larger and larger share coming from the general treasury, which is a political problem for us today. Where do the dollars go? You can see again by Part A, Part B. Part A is the hospital inpatient service. Only about a quarter of spending is going to the hospital part, which was, as we recall, the original concern of Medicare was the acute hospitalization cost. That's only about a quarter of the spending now. Another 5% is in skilled nursing. Physician payment is about 13% of total payments. This is going into Part B. And then outpatient departments, another 6% of Medicare spending. Now, outpatient didn't used to be a big feature of the spending until technology drove a lot of care from the inpatient side to the outpatient side. And this is the challenge with a program that's 50 years old. Technology changes what kind of services you need to cover. And this chart helps you see some of that shifting happening. Home health is a big chunk. It's around 4% and it takes both Part A and Part B. Other services would be things like physical therapy and types of occupational therapy, speech therapy. The therapies are a big part of some of this other Part B. Medicare Advantage, which I know you'll hear about more from a later speaker, is about a quarter of spending, and this is the payment for people to go into managed care plans. So Medicare pays a premium into the private sector, and the private sector decides how to pay what the benefits are going to be and how to pay the providers. And since we've had Part D since 2003, the outpatient prescription drug piece of spending is now 10% of total Medicare expenditures. So that's where the money is going. And that gives you some sense of what's happened over the last 50 years in terms of spending, types of spending and where it's going.